I think it will be actually very interesting to ask the question about distribution of Google Glass in our community next year and see how much it's ramped up. So our afternoon or midday conversation is with Bryan Sivak. Bryan, as many of you know, is the Chief Technology Officer of Health and Human Services. I probably don't need to explain more than that. Katherine Mulready is the Senior Health Advisor to the Governor of Colorado. And in that capacity, she is instrumental in all of the health policy that comes out of his office and the formation and execution of it. So we're very pleased to have both of them here. We, in most of our work, don't tend to focus on policy specifically. We tend to focus on solutions in the market. Obviously, policy and policy changes influence that significantly. But it hasn't typically been our area of expertise, which is why we love coming to places like the Aspen Institute, where there are lots of people who are so excel at that, like Ruth Katz. But today we thought it would be interesting, since our focus is on the consumer experience and how, in some of the activities you've done, how rapid prototyping and fast iteration and engagement of the user is important in advancing change. In talking with Katherine and Bryan, we thought it would be interesting to ask the question if consumers could have a more active and engaged role in the formation of policy. Could we apply concepts like rapid prototyping, rapid development, and test, iterate, test, iterate? Could we apply some of those principles to the formation of our laws, the way that we write and pass our laws? And if we could, how would the ACA have been different? So with that, I'll let Bryan say a little bit more about what he means by agile legislation, which is the term he gave it.
Thanks, Carlene. So I guess I want to start off by saying a couple things. First of all, some of these thoughts in general are really kind of born out of my background as a programmer. I'm a computer scientist by training, although it's been a long time since I've actually sat down and jockeyed code. But you know, a lot of what we spend time thinking about today is actually how we develop products both internally and externally to government in getting away from the sort of standard waterfall style of development, moving more towards agile development, which most entities out there other than the government are kind of practicing today. And so that sort of naturally led me to this thought about, you know, why couldn't we actually make laws in the same way and actually create legislation with input from our customers, our users, our citizens, and test those things on a rapid basis, go back and forth and see sort of how you know, how we could learn from gathering data and folding that data back into future iterations. Now, obviously, it's a lot more complicated when you're talking about legislation and laws that have sort of broad impact and take a while to scale and take a while to generate the data that you need to actually make some of those decisions. But I think the general framework of how our democracy is meant to exist is actually supportive of this concept. If you think about the old quote that states are the laboratories for democracy, in a lot of ways you see some of this happening in states, and we might talk about just some examples of this later today. One that immediately jumps to mind given our location is the marijuana initiatives in Colorado and Washington, I believe, right? And what's interesting to me about those is watching how these two states are experimenting with this new set of laws and learning a whole bunch of lessons really, really quickly, which I'm sure you can talk about in a lot of detail, that now other states are starting to say, hey, we can, you know, kind of do this stuff too and learn from some of the things that these other entities have gone through in the past and kind of fold those into our new legislation. And maybe it takes a little more time, but at the end of the day, you can imagine a set of laws that are now informed by experience as opposed to just sort of massive monolithic structures that were dropped onto a unsuspecting citizenry and, you know, fingers crossed that there were no unexpected or unintended consequences that happened with that. So that's the general background for thinking. I think we'll probably get into some specific conversations. The other thing I would like to say is that for me, this is very nascent thinking, and it's sort of a constant process of learning about things that have happened and things that are happening. But I find that every time I have a conversation like this with smart people, either inside of government or outside of government, it turns into an incredibly fascinating discussion. So that's part of, I think, why we're here today, but also I'd love to include the audience in the discussion if we can as well.
Sure, absolutely. Katherine, would you like to just tell us a little bit about yourself and how, in the example that Bryan gave or others, this actually is in existence here in Colorado in some form?
So thank you. And on behalf of the few Coloradans in the room, welcome to our lovely state. It's always like this. The weather's always this nice. But yeah, so the concept of this agile legislation and kind of modularity and a modular approach to developing legislation is, as Bryan mentioned, some of his thinking, and we've had a brief conversation about it, but as he indicated, I think what you're really going to see today is us thinking through it more and hopefully with you. And Bryan's perspective is federal and mine is state. So when he said we should stop passing these giant monolithic laws, I said, well, not every law is monolithic. Actually, even the ACA, which is right the behemoth in our midst, is actually pretty agile. And there's a lot of states that are using that to tweak what they're doing, choosing to expand Medicaid or not expand Medicaid, do a state-based exchange or not a state-based exchange, apply for grants funded by the ACA or not apply for grants funded by the ACA. And so, there is a lot of dynamism in the state health policy environment. But at the same time, we're still kind of hampered or within the box that is the restrictions or the limitations put on us kind of either by ACA or things that preceded ACA at the federal level. And so I think there's certainly a lot of potential in the conversation around how do we get more rapid cycle or more adaptable policies in place. One of the things that helps Colorado keep our state-based legislation pretty modular are I think maybe a few things. First, our state legislative process has what we call single subject bill title system, right? So you can't call something a healthcare bill and then throw a bunch of transportation stuff in it. You can at the federal level. And that's one thing. We also have a part-time legislature. They're only in session from January to May, and they're not professional, or it's not a professional system. And we have term limits in Colorado, as do many Western states. And so that keeps the education cycle pretty short, pretty simple, and it keeps the legislation moving pretty quickly. You don't get a whole lot of deeply entrenched interests in the legislative structure itself. And then finally, another thing that is more natural to Western states than the country generally is the citizen initiative process, which is how we got marijuana legalized in Colorado, and recreational marijuana, adult use only. The whole campaign was regulate marijuana like alcohol. And actually, Governor Hickenlooper, who I work for and have done so for 3 years, was pretty vehemently opposed to it when it passed. But when you get citizens to sign a petition and get something on the ballot, and that ballot initiative becomes part of the state constitution, and your job as governor is to enforce the laws and constitution of the state of Colorado, we had to implement it. And so we kind of applied our administration's philosophy that despite not necessarily wanting to set up regulatory structures, you need to do it well, and you need to prove to the rest of the country that it can be done well. And so we have focused a lot of our efforts on the regulatory structure around legalized recreational use marijuana. We track it from seed to sale. That's a huge, huge component. And then we use the tax revenue for education, prevention, research. Research has traditionally been pretty hard in the marijuana field because of limitations on federal funding, because it's a controlled substance. And so we're funding a lot of local research projects that weren't possible before. And we have a lot of cottage industries that are growing up around it. I think the most interesting of which is descenting money. And literally taking the marijuana smell out of cash, because no, not kidding.
People don't want money to smell.
No,
That's
so
actually a great example of something you never would have thought of, right, when you passed the law.
and so
That's hilarious.
because of FDIC rules, no bank, no credit union, no nothing can openly do business with a marijuana, anyone in the marijuana distribution chain. And so it's an entirely cash business. There's a lot of concern about crime around that, which is separate. But as a result, marijuana businesses tend to take money to the bank in bags, cash into the bank in bags, and it smells like pot. And the minute that the bank recognizes it smells like pot, they're kind of on notice that it's probably from a marijuana business, and they get all anxious. And so, so literally, we have, I think, 4 companies focusing on a chemical process to descent marijuana.
That's amazing.
Yeah. So I don't know, a couple.
There's some people in the audience who might want to fund that,
Yeah.
I'm sure. Brian, can you,
Sorry,
you want to ask a question? I was just going to ask if you, in your prior life before HHS, you worked in Maryland. Is there an example from your prior work of modular legislative development that, or modularity that you can share with us that you think is an example of what we might be able to do? And
Yeah, actually, one thing that I worked on while I was there was something called the Maryland Innovation Initiative, which was really it was a bill that we got passed through the legislature that was designed to enhance technology transfer from the state, the universities in the state. Turns out, as I'm sure is the case across the country and actually all across the government, on the federal side especially, there are literally hundreds of thousands, if not millions, of inventions that are literally waiting to be commercialized. People just don't know that they exist, or they don't know how to commercialize it, or the universities aren't investing in the right ways and things like that. And so we designed a bill to essentially build a process to change the culture in some of these institutions to enhance this. But part of that was a section of the bill that required metrics to be generated from the process, and every subsequent year those metrics would be reevaluated to determine whether or not the money that we were investing was being invested in an intelligent way, and if so, great, we could put more money to it, and if not, it was required that we actually had to tweak the program to change the way it worked. And so it's that kind of metrics-based development that I'm thinking that I'm kind of thinking about when I'm talking about this. Like, let's put something out there. Let's generate some metrics. Let's look at those metrics and come back and tweak things on a relatively frequent basis. And so, you mentioned the Affordable Care Act, right? And I agree. The way that in general laws are written on the federal level is that they're very vague, and they're very vague because the federal executive branches that are responsible for implementation then go in and write detailed regulations for how those relatively vague laws are going to be implemented. But what doesn't happen, or at least what hasn't happened with the ACA, for all the political reasons that we're very familiar with, they haven't gone back and said, what elements of the law do we need to tweak based on things that we've learned since the law has come out? And believe me, there are plenty of things that both, if you got people outside of the political spotlight, both Republicans and Democrats would stand up and say, yeah, sure. There are lots of elements that we think, now that we've learned some stuff, we could definitely adjust in a future amendment or a future version of the law. The problem is that we exist in this highly politicized environment where it's either repeal it and get rid of the whole thing entirely, or don't open it up, because then it opens it up for all kinds of crazy changes to be made. So, that's kind of what, and when I think about this from the political perspective, that's the problem that I see, right? Is that we don't have the ability right now to go back in and adjust individual pieces of it based on things that we're learning, at least on this sort of big federal level. I think it is a lot easier on the states because they, again, for all the reasons you mentioned, short-term legislators that only meet for short periods of time, term limits, ways to craft bills, all kinds of things like that.
But I push back a little bit, Brian, because I think, certainly the congressional statutory process is in full-on gridlock. It's the topic of every conversation. But even HHS at a regulatory level, right, has a hard time learning from its mistakes.
Totally.
And being more flexible to the extent they can under that law. So maybe regulatory systems are a better place to start.
I'll give you a great example. How many people here have ever heard of something called SACWIS? SACWIS.
SACWS?
WIS. I'm not surprised that many of you haven't. So SACWIS, I think it stands for State Assisted Child Welfare Information Systems. I think that's what it stands for. Basically, Administration for Children and Families, which is a massive entity within HHS, is responsible. One of the things that they're responsible for is providing federal grant funds to child welfare programs that are run out of states. And I mean, these child welfare programs, if you sit down and ever talk to a practitioner in child welfare, the stories that they tell you are some of the most like heart-wrenching stories you've ever heard. I mean, these are kids who are in these incredibly bad situations and circumstances that you have these incredibly dedicated people who are doing everything they can to try and help. And so in the 90s, I think it was 1996, a law was passed, an actual law was passed that we wrote regs for, that mandated certain characteristics of a SACWIS compliant system, that if a state were to build these characteristics, then they were able to receive this 90-10 federal match money to pay for that system. So in 93 or 96 or whenever it was, a whole bunch of states went out and applied for this money. They built these systems, and these systems became quote unquote SACWIS certified. Fast forward 20 years or so, these regs have never been changed, okay? Think about where technology was in 1996, and think about where technology is today. There was no such thing as the cloud. There was no such thing as this, for sure. There were no apps. There were no idea of modular development. Agile hadn't even been a concept that people had uttered at that point in time. And so what we have now is a world in this child welfare ecosystem where all of the systems that are being used are completely archaic from the perspective of their implementation, the technology they use, the way that they share information, the way data is transmitted between all of these different systems. And for various reasons, HHS has actually tried to adjust these regs, but have not been able to. They actually, I don't know if you guys are familiar with the process for how regs are created or modified, but basically every agency, when they get into this, they put out what's called an NPRM, a Notice of Proposed Rulemaking. That's out there for a while for comment. We take those comments back in, we look at all of them, we have some listening sessions, and then we write a final draft rule that gets published in the Federal Register, and that contains all the regs. In 2010, Administration for Children and Families went out and actually solicited comments in an NPRM for an update to SACWIS, and we got a whole bunch of comments, as you might imagine. That still sits, and we have not yet done anything with that. So your point is exactly right. There is the legislative process, which is way beyond my thinking about how to change in this political environment. But there's also the regulatory process, which we actually could affect on a much more frequent basis, and we could actually start to build more iterative and agile processes into the reg process. And you guys are the recipients of a lot of this stuff, so I'm sure you have some examples too of where that could be better.
Yeah, I think the debate we always get into, right, as a representative of the administration, and generally we engage with our state legislature rather, I should say state legislature more than with the federal process. But there's always a tension between how much faith legislators have in the administration or an agency's ability to implement, and that impacts the language they use in their legislation, whether it's tight or loose, and the desire for the administration or agency to be flexible and have a more flexible approach. Part of that, I think, in Colorado in the healthcare environment, we've had some laws that were great and worked really well under certain administrations. But if you're in a purple state where your administrations are likely to change in election cycles, when the parties switch and the philosophy switches, they use the flexibility to the detriment of what the original legislator wanted to achieve. And so there's just always that tension there, and I think it's an important one to recognize in any process. But I will share with you the challenge of trying to get regulatory pieces changed.
So one thing that I've thought about, and I'm curious what you think of this concept and what anybody else out here thinks of this concept, is the idea of outcome-based legislation. So what if, let's just take one element of the Affordable Care Act, which would be the marketplaces, right? The idea that we create these marketplaces to get people who are uninsured to sign up for healthcare insurance. What if instead of the law actually saying things like every state will build a electronic marketplace, it will contain these QHPs, all of the things that it does say about that. What if they said something like, by this point in time, the outcome that we would like to see is 8 million uninsured people covered in healthcare. And here's how we're going to measure that coverage. Executive branch, here's $100 million, whatever. Go and do this, go make this happen. And then it's up to the executive branch over the course of X number of years to show progress towards that goal to the legislature, right? In order to say, yeah, we're moving towards what we decided was the appropriate outcome. And then the legislature can say, oh, great, you're hitting those targets over the course of those X number of years. Here's more money if you need it based on your plans that you're developing and the impact that you've seen based on the initial investment to go and do more. Or this isn't working. We're not going to give you any more money to do this until you figure out how to make it work better. Just a thought.
Yeah, I mean, I think it's a great thought. What I'd say is that really presumes that the executive and the legislative branch has like a nice collaborative working relationship, right? Which is a hard thing to achieve at the national level. We
democracy. It's supposed to work that way.
In Colorado currently, we until November, we have a Democratic governor. We have 2 Democratic chambers in our legislature. In theory, you'd be like, oh, you should get a lot done. It's actually harder to get things done that make sense for the state in a really purple state. When you have kind of full control of the legislature. As an administration person, we had a much easier time when we had 1 Republican chamber and 1 Democratic chamber, because all the wacky stuff gets totally weeded out. And so you can really focus on the things that are in the middle. There's an incentive to compromise, and that works. And I think in that sort of circumstance, we probably would have been able to. But again, the changeability of it, even if you're looking at a 2-year period of passing legislation and implementing a program and looking at outcomes, if you have a 2-year election cycle, which obviously all of our congressional folks have at the national level, and we also have at the state level, you're never given a full 2 years, right? You have about 1 year and 2 months before campaign season starts again, really in earnest, and that's a hard turnaround time that I think we have a challenge really trying to implement and deliver. I'd give an example of one innovative strategy that we have been working on now for about 2.5 years. We passed legislation in Colorado giving our Medicaid agency authority to test payment reform, right? And we're a pretty progressive state in the arena of fixing healthcare, because fixing healthcare is actually a bipartisan issue here. The question is, how do you go about it? But we got that payment reform initiative passed. We sent out RFIs, asked kind of people in the healthcare community, hospitals and payers and collaboratives of hospitals and payers and providers to send us their ideas. We got some ideas. We sent out an RFP. We funded one. We can't get it through CMS. So once again, Bryan is the evil guy, right? Or his agency, not Bryan himself, right?
I should point out at this point that I am not CMS.
Yeah,
I just happen to be affiliated with him.
Yeah.
Well, Bryan, have you shared this idea about modularity with anybody inside HHS or on the Hill, and what's the reception to this concept?
I mean, I think the problem is that it's like with any big change, it's hard to imagine how you change a system to affect a massive change all at once, right? And like I said, like the Hill and the way federal legislation actually works is way beyond like anything I can even possibly imagine how to change. But on the regulatory side, and how to get things like what you just described through, like there are very simple ways that we can think of to do this, right? It just means that we have to all be aligned on our side to be willing to experiment and be willing to actually take some chances and see what happens as a result. I have seen sort of a small bit of progress, I think, since I've been at HHS towards that framework. People are a little bit more open now to exploring different opportunities and different ideas and thinking through how we might take a program that could, we could maybe generate a waiver for something, generate metrics off of that and then figure out whether or not that's going to work. I mean, CMMI, we talked before, Center for Medicare and Medicaid Innovation was set up as part of the Affordable Care Act, is supposed to basically pilot different models for payment, pilot different innovative technologies, and then if those technologies or if those new payment models prove by the CMS actuary actually proving that the innovation or the intervention leads to a reduction in cost in healthcare or an improvement in quality or both, then the Secretary of the Department of Health and Human Services has the authority to order Medicare to pay in that way, which is a huge, huge difference and a pretty important mechanism that we have to use. Now, we have great people who are working at CMMI. We have people who totally understand the value of this mechanism, and yet we still have not, in 3 years, authorized the payment, authorized a different way of paying for something based on tests that have been running.
Why is that?
It's a great question. I don't know the answer to that.
You know, I think
I mean, I would say it's politics. I would say that it's, you know, the especially in an election year, and I hope this is not being taped, but in an election year, you know, you've got a lot of issues that you have a lot of constituencies that could get either happy or unhappy about certain decisions that are made. And so, you know, the amount of risk that gets taken tends to shrink, right? And then maybe expands for a short window after that, but then it shrinks again. And as a result, we don't see a lot of progress along those fronts. And so, I mean, for me, a big plus would be if we could remove a lot of the politics from the equation. I know it's a simple thing to say and an impossible thing to do, but if we could look at the impact of the work that we're doing and try to figure out how impact could be divorced from the politics of this universe, I think we'd actually go a lot farther.
I think it's worth considering too, especially for this audience, and we'll go to Q&A in a minute. If we could implement a system of rapid testing, rapid prototyping, so that the actors who are creating the legislation and bargaining to pass the legislation could test and fail and iterate, have the opportunity to test and fail and iterate more frequently, as in business, as in, you know, product development, that lowers the risks for them, right?
Right.
But they have to be willing to try it to actually, I mean, I guess, you know, the $64,000 question is how do you get them to?
Well, you know, one thing that's kind
Cross
of
the
interesting
divide.
is that there are hacks to the system that have happened in order to allow this concept to sort of get out there a little bit. So how many folks out there have heard of social impact bonds? Some of you? Okay, cool. So for those of you who don't know, a social impact bond, it's really interesting. Basically, it's a mechanism by which policy initiatives can be experimented with, or policy initiatives can attempt to be achieved through experimental programs that are funded by private sector investors looking for a return on their money. The simple use case that actually was first piloted, well, simple, the easy to understand use case that was first piloted in the UK a few years ago on this was around recidivism. So when inmates are released from jail, there's a very specific and tangible cost associated with the number of individuals that go back into jail, that are reincarcerated for doing something wrong. And there are a whole host of programs out there that have some really interesting ideas to test to see whether or not they can impact recidivism in a positive way. What's interesting is that if you impact recidivism in a positive way, that is a net savings to a governmental entity. And so what the social impact bond mechanism is designed to do is to allow an external, in this case, is to allow an external investor to fund the implementation of that program. And if there are any net savings, they get their return out of those net savings. So it's risk capital, right? It's investors that are looking for a home for their dollars, and I think the one in the UK was a 13% return. Sort of that was the basis of the investment. And it's kind of an interesting way of thinking about experimenting with policy initiatives, right? Does this one program work to reduce recidivism, right? Without having the governmental entity put the money out there to try it. And so that's one hack, really, of the system that has been created. And we're experimenting now with this in the US and a whole bunch of different places. And so, you know, it's what's interesting to me as a you know, developer, I guess, in a way, is that, you know, when you're writing code, you're always looking for kind of hacks or shortcuts to make things work better, more elegantly, faster, et cetera. Like, these are people who are kind of looking at the sclerotic nature of the legislative and regulatory systems and thinking about ways to kind of hack around it that are completely legal but are just brand new and experimental. And so that's where I get kind of excited.
And I think it really is exciting. And we have a social impact bond program here in Colorado, and we've been working on it for about 18 months. So it's pretty new, new to us and in our timelines and systems. And I will tell you, just as health folks, one of the reasons we've strayed away from health projects for social impact bonds, there's a ton of really great projects that would fit that system so perfectly. But the fragmentation of the financing system in healthcare makes things like focusing on, even in the corrections industry, right? Like, if you focus on inmate healthcare, the savings don't accrue to the system that bears the cost. And so in the social impact bond model, it's really a diffusion of the funding that is a result. And yes, it's a net cost savings to the government, but we all have our line item budgets, and it's been really hard. So we've actually, despite wanting to do some of that work in healthcare, we've taken it to other industries and other opportunities because we couldn't make the line items work.
So
See, that's an accounting problem. I mean, we should be able to figure that out, right?
Yeah.
That's interesting.
questions from the floor, please, Christy. So I had a colleague with Can you wait for the mic?
Colleague from Google a couple weeks ago. He works in the strategy and ops division, and the conversation was around one of the reasons Google is able to innovate and to be agile and to move so quickly is that they have the capital to do so and to weather failure. And so one of the things when we talk about agility is being agile is that when we have a failure, we can pick ourselves up and do it again. So I was wondering if you have thoughts, either from the federal or state perspective, on how do you decrease the cost of failure in a way that makes it sustainable, so where we can actually realize these innovations?
I think that's a great question. I don't think so much for government that it's the financial cost of failure that we can't tolerate, it's the political cost of failure that we can't tolerate. So absolutely, in rapid cycle testing, you want to fail fast and move on, right? But in government, there's no incentive to fail fast because you're always going to have someone's election around the corner. And I don't want to say that it's all driven by electoral politics. Even at the state level, just our budget cycles, and we actually pass the budget every year. We have to. But your failure is always going to influence the legislature's perspective of how well you can do your job. And there's just a very, very low tolerance for failure in government because constituents feel that it's a waste of money, right? I mean, yeah.
So I have another answer for this. So this is actually, what you just asked fits in very well with like literally everything that we spend a lot of time working on every day. And I would agree that it's not financial in nature. We have a lot of money, right, at the federal level especially, but even at the state and local level, while budgets are tight and people are cash-strapped, trust me, there's a lot of things that can be done, because I've seen it in all three levels, to reduce costs and actually do things in a better way. So it's not financial. The issue is, I think, a fundamental issue around incentives. Right now, every government employee, for the most part, is incentivized, most government employees are incentivized to follow process over delivering outcomes, right? If somebody has a responsibility to do something and they follow the process that's laid out, whatever that process is, whether it's right or wrong, and everything goes wrong at the end, right? Like something doesn't launch or a program doesn't work or whatever, they get to stand up and say, hey man, I followed the process, it's not my fault. But if they try something that's outside of the bounds of the process that they are supposed to follow and everything goes wrong, well, guess what? Then it's your fault because you didn't follow the process. And that's what has to change, right? A fundamental change around the incentives that we hold, or that we provide really for all of these very dedicated civil servants that we have across the board. So this is in large part, a lot of what I spend every day trying to do is actually create an environment where the incentives are different. And we've implemented actually a couple of initiatives that essentially give career federal servants the opportunity to experiment with new ideas. For example, we have this internal accelerator that we created where we essentially pick cohorts of teams from across the department, give them 3 months, give them $5,000. I mean, it's nothing, right? And more importantly, give them instruction on some modern methodologies like lean startup, like business model canvas, like design thinking, human-centered design, all that kind of stuff. And use the methodology and sort of our levers that we can provide to give air cover to these teams over the course of 3 months to really just focus in and experiment with their ideas. And what's fascinating is that just like any cohort in any accelerator, some of them are going to fail, right? There's zero question about that. Some of them are going to like blow it out of the water, and some of them are actually going to kind of get somewhere, maybe great, maybe not great, but kind of in the middle. And what's cool about it is that we're actually seeing these people learn, most importantly, we're seeing these people learn these new skills, understand that, for example, the Silicon Valley pivot is something you can do in government, right? I've got a great story, I don't think we have time, but I have a great story I can tell you about the Indian Health Service and this team from the IHS who, were trying to do this thing with a kiosk and it didn't work, and so they pivoted back to a paper form and an MVP, and like, it's amazing, right? And so we can teach people how to do things in different ways. The idea is that when the cohort's over, either the ones who are successful keep doing what they're doing, and we have actually a venture fund that we've created to invest further in those things. But also the people who don't go forward can just take those ideas and bring them back to their home agencies and say, wait, there's a better way of doing this. And then we're there to help provide more air cover and to provide those incentives, hopefully, for people to do things in different ways. So that was a long answer to that question, I'm sorry. But
I just want to point out before we go to the next question that from a private sector focused audience, it's interesting and amusing that the political pressure that restrains experimentation is the rapid election cycle, where in a free market environment, a rapid election cycle would encourage you to fail faster, not do slower. So I think much of this is really a question of perspective, and it's like all the really difficult things, culture change. But next question, please.
Hey, Bryan, so you talked about kind of like agile legislation and kind of how to iterate on that. Have you seen any examples, or can you point to any where laws were passed with some KPIs and stuff set out that would create an opportunity, right? Because the current democratic process is very waterfall, kind of by design. And so I'm just thinking out loud, if you wanted to embed agile in that, have you seen laws that try and create structures where post-law, this sets these up points to iterate and refine within some bounds?
So it's a really good question. In preparation from this, I actually asked a whole bunch of people and that exact question and did some searching to see if I could find a good example. And one friend of mine who works in the policy group at Commerce gave me one example of a $7 million program that was created by Congress that was quote unquote experimental, and the idea would be that if it was successful, they would allocate more funds to that. But the metrics I don't think were defined, and I didn't get a good satisfactory response about whatever happened with it. So I have not come across a good example.
I can't think of a legislative example, but in the health space, Oregon, I think they have a big, giant, mega waiver from CMS around all sorts of Medicaid rules, and it is an outcomes-based contract, right? They have to meet health outcomes, and the state itself is at risk. So they have a huge incentive to do it well and to get everybody in the pool and do that. So I think we're starting to see that, but it's not legislative.
I guess actually, I mean, when you frame it that way, in some sense, things like Race to the Top could actually be thought of as this sort of thing. Although then you get lots of disagreements about what the metrics are and whether we're measuring the right thing and all that kind of stuff.
That's very much in debate now.
Right.
Right. So,
Right.
next question.
A comment on the last. There is an example. No Child Left Behind was exactly that. I was on the Illinois State Board of Education while we were implementing NCLB. Specific disaggregated data sets, annual yearly progress, 15-year time horizon, measurement corridors, interventions, and I think it's an insight as to why we don't tolerate failure in government. So when the data started getting bad, everybody panicked.
Right.
Right.
So the problem, I think, is that we have to figure out how to deal with those, the bad data. What ought to have happened is we should have looked at why the data was bad,
Right.
funded the insights, and it took a decade to get to Race for the Top
And that's,
before we started to do it.
yeah, and that's exactly kind of what I'm saying. I mean, that's the whole, like when you're writing software, right, that's the whole idea behind agile development. You get teams of people together, you write modules, you test those modules, you put it out there, you see how it goes, you bring them back together, you rewrite, you retest, you do that rapidly and iteratively. When you get a bad, when you get something that doesn't work, you don't throw up your hands and go, oh my God, that sucks, we're not going to do that anymore, right? So your point is exactly right on. That's the thing that needs to change, I think.
Next question, please.
I think that the conversation really is fascinating, especially in the context of technology and healthcare. And I really appreciate the point that was made a moment ago, which says it seems counterintuitive. A rapid election cycle you would think would lead to fail quickly. And you say to yourself, why is that not happening? And I think that begs the question of what I think somehow has been missing in the conversation, and it is important to acknowledge, which is the role of special interests in this election cycle. It acts as, I think we all recognize it, but to not somehow understand how that is influencing how we as a society, both at the state level and the federal level, are making decisions, good or bad. I'd love to hear anybody's comments on that.
Yeah, is that Dan back there? I think, sorry, the lights are really bright. I think that's a hugely, hugely important point, and I think you hit it right on the head. Someone's cost savings, right? We're always trying to bend the cost curve, reduce costs in healthcare. Someone's cost savings is someone else's bottom line, and that's never going to go away. And in Colorado, we generally tend to take a really collaborative approach to solving problems, especially in health, because we can't do it without everyone's buy-in. I think the challenge there is that you make very public commitments and very public compromises, and that locks you into a position where you may not be doing the best thing, you're doing the best thing possible. And that's a challenge for policy generally.
Can I tell the same story I told this morning?
Sure.
I mean, the story that I told this morning is exactly, in line with this. So I learn about things on a relatively frequent basis that just infuriate me, because it is perfect examples of these special interests sort of gaming the system, if you will, to produce outcomes that are not at all what we would think would be the right things to do. So the example that I've most recently learned about is in the organ transplantation space. Basically, the strategy or the algorithm for how we allocate organs when they're procured from an individual, those algorithms were written in the mid-'80s, basically. And if you think about it, between the mid-'80s and now, a lot of things have changed. We can keep organs viable for a lot longer. We can transport organs to farther away places within time frames. And so HRSA, one of the entities, one of the optives in HHS, is responsible for sort of managing this process. And for years, they've been trying to change the algorithms, or at least trying to propose new algorithms for the organ allocation strategy. Every time they do that, the problem is that there are going to be winners and losers. And the losers will be, in this case, the major transplantation centers across the country. Furthermore, it turns out that transplantation procedures are essentially some of the highest margin procedures for many of these entities. And so, of course, when the strategy gets proposed and these centers realize that they are going to lose some of that revenue, all of a sudden the pens come out and the lobbyists descend on the hill, and nasty letters get written from Congress to HHS saying, how dare you go down this path, and nothing ever happens. And as a result, people are dying, right? Because we're not getting the livers and the kidneys and the hearts and the lungs and everything else to the people that actually need them when in the right place in the right time. And it's a travesty from my perspective. So how do you solve that? I think the only way to solve that is to figure out how to engage our citizenry, the broad citizenry, right? And engaged citizenry, I think, is a fundamental requirement for an effective democracy. And it's the only thing that I can think of that's going to have the leverage to stand up and fight against those special interests. Because right now, the people that write the nasty letters to HHS, they are funded by the special interests, right? They still need people to vote for them, but if we could figure out a way to get people to get out there and vote and care about, you know, these things that are happening, we might see a change in that.
Well, that's a problem that's a little bit bigger than the minutes we have left. One more question, please, and then we'll.
I agree so much with what's been said, particularly around the nature of what's being incentivized. One of the things that we've seen here in Colorado, we have this fabulous computer system called the Colorado Benefits Management System, which has cost a lot of money and not worked as well as anyone would like. When I think about this notion of agile legislation versus incremental, I think about the cost of that. So the cost of moving these huge ships, and part of that is certainly databases and IT based. From your perspective on the federal level, has there been talk about doing more kind of mass purchasing? So there's only a couple of vendors that can create these kind of systems. Would it make sense for the feds to not have a mandatory system, but certainly an optional system at a much reduced cost, to streamline so that when changes are made, especially if they are more agile, the states can't keep up on the technology side with even rulemaking changes? So how can we, I mean, I'm just thinking in a very pragmatic way.
So there's a lot of things in that question that you just asked. I want to address a couple of points. Number one, I actually fundamentally disagree with the statement that there are only a couple of vendors out there that can build these systems. I actually think there's a universe, like a very large universe of vendors out there, both big and small, that can actually do a lot of this stuff. We just don't have the procurement systems and rules in place to take advantage of that, number one. Let me give you an example of where we're actually thinking about doing exactly what you're describing in a much better way. So one of the things that HHS also does, as you guys know, is manage Medicaid. One of the things that we spend a lot of money on through the group CMCS within CMS is funding Medicaid management information systems. A woman named Jess Kahn runs the state systems group, and she's one of my favorite people at HHS. She totally gets all this stuff. You know, you talk to her and she'll, you know, one of these MMIS systems will cost anywhere between $100 million and, in the case of California, $1.5 billion to implement. Jess will tell you that she's like sick to death of writing checks for $500 million for things that are pieces of crap, right? So actually yesterday before I got here, there was the annual Medicaid Systems Conference in Denver. And I got up on stage and talked with Jess to a bunch of state health CIOs and other people in the room about this new vision that CMCS has for how MMIS systems can be implemented. So instead of the $500 million check that goes to Accenture or Deloitte or ACS or whoever, instead, we're going to get there. It turns out there are 12 states right now that are like right in the beginning process of redoing the MMIS. And so we're going to get all of them together. We got all of them together. And we're saying to them, let's build one modular MMIS. And each one of you guys, why don't you build a module and have that module be available in an open source, you know, maintained code base so that anybody can take advantage of it, that meets the standards that we want to see, right? And then theoretically, each one of those things will be reusable across the board and will cost a whole hell of a lot more money than it usually does. Oh, and by the way, we're not redeveloping the same thing 50 times, 56 times, right? Instead, we're going to develop it once and we're going to test it like continuously and we're going to add code to that. So that's where we're going. Right, and that's exactly the problem. Now, believe me, there's a lot of pushback on the vendor side to that, right? For all the same reasons that we talked about a second ago. Because as soon as you go down that pathway, money's coming out of somebody's pocket, and when money comes out of somebody's pocket, they're going to start yelling about it. But I think that's where we all can activate sort of our networks and our voices and say this stuff is really important, and if we do it the right way, we're going to have a whole lot more money to spend on things that actually matter in ways that will change the system overall.
That is a very nice note to close on. So with that, thank you very much, Bryan and Katherine, for joining us. We appreciate the discussion. We will go now and transition into our second workshop. Oh, sure, yeah. Can we do that quickly? Just put up the results from the quick little digital survey you took before we started the discussion. While they're doing that, I just wanted to reiterate most of you got your meeting assignments. If you have any questions about it, or there's someone you requested to meet with who isn't on your list, let us know. We are very deliberate about leveraging the dinner seating arrangement to give you more time with people that you've asked to meet with. So in some circumstances, a dinner partner at your table may have been someone you requested to spend time with. And if there are people on your meeting list who you did not request, it's because they requested you. So in keeping with our community ethos, we would really appreciate it if you would honor those requests. Or if you can't, let us know and we'll facilitate doing it another way that's more convenient for everybody. So I can't actually see those I can't actually see that. Can you read
I
that?
can read it if you want.
Brian's going to read it for us.
So what's your primary reason for attending the retreat this year? It looks like the majority of people said networking, 43%, followed by thought leadership and exchange at 30%, followed by strategic opportunities and business development, followed by presenting, and then nobody said they wanted to have fun.
No, nobody said they wanted to have fun.
Really?
Huh. We're marketing this the wrong way, I think.
The organizations that people represented, 42% digital health technology or services providers, 23% healthcare services companies or organizations, center of excellence, 9.5%, investors, 9.5%, and then other, 14%. No insurers, no employer benefit providers.
So they just didn't respond. Because we all know that's not
I'll
true.
follow directions.
First year for a majority of people, second year
That's
by a
great.
small,
Excellent.
lesser majority, or lesser minority.
Let's do one more, Jen. Your primary mode of transportation.
Private aircraft, 10%. Everybody raise their hands. I want to ride back.
Fair enough.
Okay. Last one.
And the
Oh,
themes
thank
of
you.
trust was the theme that resonated
Excellent.
the most.
Great. We're happy to hear that. Well, for those of you who are going into the Trust Workshop, enjoy, and we will meet back here in the afternoon. Actually, we're going to have 2 workshop sessions, and then some of you will have a couple of one-on-one meetings, and then we'll adjourn for an hour and a half or so and reconnect for the reception tonight.